Hi, my name is Khairunnisa binti Mama HUSSEIN, and I'm a BBM student. And today I would like to present my poster on the assignment for sensory organ disease. I'm going to show you guys my poster. This this is my poster about the amblyopia, the sensory eye organ disease. First, I'm going to explain the function of eye. Eye are the organs of the visual system. They have the ability to receive and process visual details, as well as enabling several photo response functions that are independent of vision. The eyes will detect light and convert it into electrochemical impulse in neurons. So, what is amblyopia? Amblyopia is a poor vision where eye fail to develop as it should. So it is also called as lazy eye, is a disorder of sight which in the brain fails to process inputs from one eye and over time favors the other eye. So it result in decreased vision in eye, so it otherwise typically appears normal. So as you can see from the picture, one is appears normal and one is the eye is like slightly inwards. And this if it's not treated, if it's not receive any treatments, it could cause permanent vision problems. So the risk factors for this disease are the premature babies, or the child with has family history with this disease, child that are smaller than average at birth, and has developmental disabilities. So what causes amblyopia? As you can see, I put the eye condition that can lead to amblyopia is refractive error, strabismus, and cataract. So the eye do not focus on the same object. So this is called strabismus. Strabismus, for example, one eye may be point straight, while the other one looks in other directions. So, like your one eye is looking in front and your other eye is looking to the left. It's like that. So this send two different image to the brain. In a young child who has strabismus, the brain chooses to receive the image only from one eye. So that could cause difficulties. So another one. Next, we have if your child is much more nearsighted or farsighted in one eye than the other, the brain ignores the blurry image from the weaker eye. And then we have a problem prevent light from entering the eye for a long period of time. The problems in the lens, such as cataract or in the clear window at the front of the eye, the cornea, may cause amblyopia. These types of problems are rare but serious. Without early treatment, the child could never develop normal vision in the affected eye. So the symptoms can be hard to notice, but the child might be squinting or shutting one eye, head tilting to hard to focus on the object, and poor depth perception. Poor depth perception means they cannot estimate the distance or the depth of the object. So the treatment and prevalence for this disease are: you can use an eye patch to temporarily block the better eye, not the lazy eye, the better eye, so that it could cause a reason for the lazy eye to function. Or use an eye drop called atropine drops for at least 6 months to improve the sight. It will be used on the better eye so that it would balance the sight for both eyes. So in addition to those treatments, corrective lenses also may be used. It can prevent it by early detection of stated vision problems. The prevalence of amblyopia in Malaysia in 2018 was 7.53%, and the 66% of those amblyopic subjects are bilateral amblyopia. Bilateral amblyopia means that the amblyopia has affected both of the eyes, and it could cause very serious because it is a less common disease. It's a less common for a subject to affected by bilateral amblyopia. But as you can see, from the 7.53, 66% is having bilateral amblyopia. The amblyopia has been a crucial worldwide vision problems, and now it is great concern to implement amblyopia screening and awareness for people to know that this disease um, is actually dangerous and it could lead to a permanent vision problem. So that is it for my presentation today on amblyopia. Thank you.